I got up in the morning and I had this crazy migraine, and then I just passed out.
Charlotte experienced her first migraine and fainting spell when she was in the 3rd grade. She's 16 today and headed for her junior year in high school in Walnut Creek. The daily migraines haven't stopped.
I've definitely missed a lot of school and a lot of class time because of migraines, and it definitely has affected how my grades turn out.
Charlotte and her younger sister, 12-year-old Piper, both suffer from migraines. Doctors say it's fundamentally a genetic disease, and it's a common problem affecting 10 to 15% of teens, particularly girls. But there are very few drugs approved for their use.
There are anti-epileptic drugs, anti-blood pressure drugs, drugs that are used to treat dementia. Any of these can be used to treat migraine, but they have potential side effects.
So Dr. Amy Gelfand at UCSF is turning to a new therapy, using melatonin, an over-the-counter sleeping aid. She's leading a study that's testing it in children and teens debilitated by migraines. A smaller pilot study last year showed teens taking melatonin nightly had fewer migraines per month than those on placebo pills.
It's fairly well tolerated. We're really not seeing a lot in the way of side effects.
Dr. Gelfand says melatonin is meant to lessen the frequency of migraines.
Before I started taking it, I would wake up in the middle of the night and I would have a small headache.
I sleep more deeply through the night without disruption, I guess, and that kind of helps me wake up without one.
UCSF Benioff Children's Hospital is the only pediatric specialty headache center on the West Coast.
I think there's a lot of interest in using non-prescription treatments for migraine in this age group. So I think it's something that is very much worth thinking about today.
In San Francisco, Betty Yu, KPIX 5.